Hi, I'm Dr. Rhett Bosnich and welcome to Newin Institute. Today you're going to see us perform a PRP procedure or platelet-rich plasma procedure on a patient who's suffering from hair loss in their right frontotemporal region. So we'll first show you the area in which our patient's suffering from hair loss. I'm just going to pull back the hair. You can see this frontal temporal region here, which has undergone an area of thinning. It's not uncommon for females to experience this. Patients found that when they're on the oral contraceptive pill, this area actually improves. Just get you to turn a little bit that way. It improves on the oral contraceptive pill, but when the patient goes off the oral contraceptive pill, it goes back to this state where you can see the hair is quite sort of fine and wiry and doesn't grow very long. The first part of the procedure that we'll go through with PRP involves us drawing blood from a patient, and with this particular technique we need to draw off 60 ml of blood. So we'll do that first, and then the blood will be spun down or centrifuged to separate out the different blood components. The component we're interested in for the treatment today is the platelet-rich component, which will be re-injected into the treated area after stimulation of both the treated area and the platelet-rich plasma. So we will draw down the blood first, and then we'll recommence this video segment in a second. We're continuing on with our PRP treatment or platelet-rich plasma treatment of our patient. We've withdrawn 60 ml of whole blood, and we're about to centrifuge it now with the Smart Prep 2 system. So what we need to do is place the blood into the portal. Once we've done this, we centrifuge the blood to separate out the various plasma components, which takes around 10 minutes to complete. So I'll just put all the blood in here, and we'll switch on the centrifuge, and then we'll continue videoing shortly. Hi, I'm Dr. Rhett Bosnich and welcome back to Newin Institute. So this is the 60 ml of blood that's been put into the receiving container, and we're about to put it in the Smart Prep 2 machine now for it to be centrifuged. This will take about 14 minutes, and we'll separate out the red blood cell components from the platelet-rich plasma and platelet-poor plasma components. So we'll recommence filming straight after this. Here we are continuing on with our PRP or platelet-rich plasma treatment of our female patient with hair loss in her right frontotemporal region. So we've taken 60 ml of blood, which is currently spinning down in our centrifuge machine, and we've anaesthetised the area to be treated, which is this triangular portion in through here. And the next thing that we're going to do is to stimulate the area with micro needle rolling with a 1 ml needle on a roller prior to injecting the PRP, and the PRP will be activated prior to injecting. So we'll just do the rolling now so you can see. This stimulates the wound healing cascade and brings platelets into the area. It will stimulate the release of epidermal growth factor and other growth factors, which are very important for PRP to be effective. We'll resume filming after the centrifuge machine has spun down the blood. So we've now taken 60 ml of blood and spun it down for 14 minutes in our Smart Prep 2 centrifuge machine, and we're about to draw off the different components. So I'll just place this up here, and you can see that what's happened is the blood has spun down into our mainly red blood cells in this component, and in the component here that you can see if I spin this around, has our platelet poor component and our platelet-rich component. So what we'll do first is we'll draw off the platelet poor component. Sometimes for hair transplantation surgery we'll actually utilise this, but today we're just going to use the platelet-rich component. And we'll draw this off, and you can have a look at this again in a few minutes. We're continuing on with our PRP or platelet-rich plasma treatment, and what we've done now is reconstituted our platelet-rich plasma. We've got just on 10 mils of platelet-rich plasma which has been reconstituted, and you can see what's left in the Smart Prep 2 collection canister is just the red blood cells. So we've taken off all of the platelet poor plasma and reconstituted the platelet-rich plasma. And what we'll do next is activate the platelet-rich plasma, and then we will inject this into the anaesthetised area of the scalp. Hi, I'm Dr. Rhett Bosnich and welcome back to Newin Institute. We're continuing on with our PRP or platelet-rich plasma treatment of our female patient. So here we have half of our platelet-rich plasma which has been activated prior to treatment, and we've already activated the treatment area by rolling with a roll kit with 1mm needles earlier. So what we're going to do now is to inject the PRP throughout the treatment zone, and we'll show you a little bit of this and then at the end of the treatment. So we're just injecting just throughout the area which is affected by hair loss. So we'll inject this whole region, and once I've finished this we'll show you how it looks. So we're just continuing to do injections with the PRP throughout the treatment field, about every centimetre. Just putting a small amount of PRP, and we'll work throughout the whole treatment zone. So we're just about finished infiltrating this whole section with the activated PRP. You can see for the patient it's quite a relatively painless procedure with not much more than about 1 hour downtime. After the procedure we instruct the patient to avoid strenuous activity at least for a few hours, and they can't wash their hair until the following morning. But normal social activities can occur. So I'll just show you that area now. So you can see it's not too obvious that treatment's been done. A little bit of spotting, but overall relatively clean and clear. It is important to note with PRP treatment that not all PRP treatments are the same. There are different types of machines, and it's very important to understand the difference between machines. You need to use machines like the Smart Prep 2 machine, which concentrates platelets at very high levels to ensure that you get good results from your PRP. And the other important aspect with PRP is to stimulate the area to be treated prior to PRP treatment with microneedling, and also you need to activate PRP prior to injection into the area. So certainly not all PRP treatments are the same. And what we'll do with our patient here is we will see her again in about 4 months' time to do some further videoing and photographs to see how she's progressing. Thank you for your time.